Does the AMH level fluctuate? This research explores how the AMH hormone, which is the anti-Müllerian hormone, a marker used to assess egg reserve, can fluctuate in women who visit a fertility clinic. This main finding is quite simple. The AMH is not always stable, and a low test does not always mean a lasting low reserve. For many, levels can vary for months or years and sometimes recovering over a period of decline. What did the researchers do? They studied over 22,000 clinic records, focusing on 1,871 women with at least two AMH blood tests. These patients were mostly in their mid-30s and attended the clinics for fertility treatment like freezing or fertility preservation. The analysis tracked how AMH changed between the first and second blood tests, sometimes months or years apart. The study showed that 34% of these women had higher AMH results in their second test, and 42% moved up below a critical low threshold, indicating their ovarian reserve had temporarily recovered. This effect is most pronounced in young women, but present across all ages. For most, especially those with intermediate results, fluctuations were mild, which basically means if you have average results, fluctuations don't seem to be huge. However, a significant minority had dramatic changes, challenging the belief that AMH always declines over time. The practical implication is clear. A single AMH test may not give the whole picture. For those with unexpected low results, especially young women with regular cycles and no fertility issues, a repeat test may be crucial. Factors like menstrual cycle phase, oral contraceptive, and sometimes even stress may affect AMH, complicating interpretation. In fact, you should try and combine other factors, looking at ovarian size, looking at the antral follicle count, and that may give you a much better idea of if the AMH may be better. And in my practice, I tend to, if a low AMH, I'll look at the ovary, and if the ovarian size is normal, it basically means that somewhere follicle recruitment would continue. It's important to realize that those women who visit a fertility clinic are not from a general population itself and don't represent the general population. It also tells us that a single bad test may not be the end. Clinical protocols may be varied, and we may be able to try and decide whether, looking at the ovary, whether we'll be able to get a better antral follicle count or if the AMH would increase. For professionals, the data provides a strong argument for repeating AMH tests when initial tests seem to be out of the clinical picture. And what I tend to do is I tend to do a day 2 FSH, LH, E2, and AMH if you have a low AMH result, and that probably on 2 counts may give you a slightly different idea.